Well, summer is in full force, and it may be hard to resist spending all day out in the warmth of the sun. Sunlight can help our mental outlook and make us feel healthier, but too much sun can be harmful to the skin. Nancy Raborn from University Hospital is here to tell us about the dangers of sun and how to prevent them. So, Nancy, the most common thing that people probably think of when they're thinking of sunburn is skin cancer. And is that deadly, skin cancer?
According to the American Cancer Society, more than 8,000 Americans lose their lives each year to skin cancer. The most common causes are exposure to the sun and tanning beds. Okay. So that's where the most common causes of skin cancer come about.
And so how can people protect themselves from the sun and the UV radiation?
That's a very good question, because due to the nature of our geographic location, it's very important for us to protect our skin. You want to always avoid the sun during the peak hours of ultraviolet radiation between 10 a.m. and 4 p.m.
Okay.
Use a sunblock with an SPF of 15 or higher. The higher the sun protection factor, the more coverage you have. And wear clothing that covers the skin. Wear hats and sunglasses with UV protection. And also speak up, teach others to protect themselves from the sun. And remember that certain medications can actually cause photosensitivity, like doxycycline, which will increase your susceptibility to sunburn.
And I thought that was really interesting. You were saying that there's a lot of medications.
Right, at least 30, drugs that can cause photosensitivity. So make sure to read the package inserts and the pharmacy labels very closely.
And you can talk to your doctor about those things as well.
Right.
Okay. And now, you said the time is between 10 and 4,
right.
But some of the other examples that you gave are things that people can do if they are going out during those times, like adding clothing and wearing the sunblock?
Right.
Okay. Now, how will a person know when they've been sunburned? What are some of the symptoms?
Well, some of the common symptoms are redness of the skin, warmth, pain, and in severe cases, moderate to severe cases, you may see blistering. In a few days, itching and peeling of the skin.
Okay. And are there things that a person can do to treat their sunburn, or do they just have to, I guess, deal with it?
There are things that we can do. One thing that helps a lot, is very soothing for the itching and the burning sensation, is to take a tepid bath, not too hot, not too cool, and add a half a cup of baking soda. And that's really soothing to the skin.
That was the one that I was most interested in. It's just a means to soothe. Is that really all? Okay.
It does. And baking soda it's sort of like an oatmeal bath, but baking soda is more readily available and a little less expensive than oatmeal.
Okay.
Or vino. So another thing too is to apply cool, moist compresses to the skin. That helps soothe the skin. And another thing as well is apply aloe vera gel 3 times a day, as long as the skin is not blistered.
And I wanted to ask about that. Now, if the skin is blistered, why is it a good thing not to do that?
Well, if it's blistered, you don't want any type of bacteria. Okay. So if it's blistered and you have shallow blisters, you can treat it like a minor household burn and apply an antibiotic ointment like Neosporin on it. But if you're not real sure, definitely give us a call and we'll be glad to go talk you through it.
And of course, you can give everybody the number.
Sure, it's 1-800-476-7378, or locally 706-737-8423. And we're here 24 hours a day, 7 days a week.
And as always, it's been a pleasure.
Thank you so much.
Thanks,
Have a
Nancy.
good day.